We're doing a little adductor canal block to try to give a little bit of medial compartment pain relief before we start our procedure. Get right down. You might feel a little bit of a warm sensation or a zing there. Superior medial genicular block here. So put some color on, see if you can see any vascular there. Sometimes you see a nice little artery pumping next to the genicular nerve. So you see that little guy there, little grape cluster there. So turn that off. That's that bone marrow edema right in there. Let's put some color on that, see if that shows anything. That the MRI really points out where there's bone marrow swelling in there, but you can't really see anything on ultrasound or x-ray there. So that's where those MRI images are so critical. Okay, save that. Blocks. I'm just now looking at the meniscus tear that we saw before. Kind of right in there, that's when we're putting our leukocyte-rich. We want to make sure there's no fluid in there, so a lot of suprapatellar fluid collection. If we just inject PRP, that's no good if you inject PRP into a bad fluid collection. So there's none up there, that's good. All right, now we're going to look for that Tib-fib. So put your heel in and then bend your knee a little bit, and then good. I'm going to see if I see that Tib-fib ganglion cyst. Normally when we see fluid collections back here, we think Baker's cyst, but this is a Tib-fib ganglion cyst that you're not even symptomatic from, which is weird, but you know, there we have it. Tib-fib ganglion cyst again. Oh yeah, hello.
Is that black hole?
Yeah,
black hole. This stuff is usually pretty gelatinous, so I'll probably have to use an 18 there. I drain these things out from my medial meniscus all the time. Getting that out is...
Oh man, that's all from the cyst that was in there?
That's all from that cyst.
Man, that's crazy.
So there's your Tib-fib right there. There's your lateral meniscus, lateral tibial plateau, and then there's a joint between those two bones, and that's your Tib-fib joint. So we're going to inject into that, because that's where that stuff comes from.
What do you inject?
We're going to inject some PRP. And we're going to use leukocyte for cold spray coming. And the needle come down into that joint. Going into the, from the spine on your tibia up to the inner part of your lateral femoral condyle. So good. Posteriorly. I don't want to put too much contrast in there because it's already got fluid in there. It's not supposed to be in there, so I'm trying to keep the volume low. And how are you doing right now? You pretty comfortable-ish?
Yeah, right.
Good. Kneecap pain?
Not particularly. At the bottom, it kind of rumbles through there.
Right. So we're getting some flow underneath the patella, so we're getting good flow throughout. Put a little bit more contrast in there. This is a mixture of PRP and plasma concentrate, which has anti-inflammatory proteins in it from your blood. A2M, IRAP, good stuff. Good. So there's a little bit of bone marrow edema right in that spot. Not a little bit, it's a lot actually. So we're going to put some leukocyte-rich PRP right into that medial tibial plateau.
Are you comfortable?
Yeah.
It's not a cyst like you have in that Tib-fib joint, but there's fluid in there that's not supposed to be in there. So we're going to see what we can do by just infiltrating it with some PRP. Then see how we get in terms of tracking. And it's mostly your anteromedial bundle. There's a posterior lateral and an anteromedial bundle from your MRI. It does look more like it's the... You gotta lower down some more. Okay, good. Excellent. Okay, come back to EP. And using alcohol, Hibiclens, combination 50-50 mix. We've been doing that for 50 years, right? So where we're going is that he's just got it right at that tibial plateau in that location, anterior slightly to where the body of the meniscus would be, a couple millimeters under the skin. So now I'm just making sure we got decent analgesia there. a little pinch, maybe not. Just got to engage in that cortical bone. Kelly, oblique up a little bit there for me. Very good. That's right where we are. Awesome. And that's good. You put a little contrast in there, don't need much.
Do you want me to move this out of your way?
Good night.
Just a little bit.
Finish up with the medial meniscus. So right kind of the anterior portion of the body, the anterior horn of the meniscus. We put some in the anterior and body and then into the body. Posterior looked pretty good. All right. Get down into there, meniscus. Look at the screen there, Lou. So just injecting into those areas of hypoechogenic signal. Okay. All right, my friend. We're good.